Uganda at the moment is experiencing a worrying trajectory of rising COVID-19 cases caused by the Indian deadly Delta variant. World Health Organization notes that the Delta variant has rapidly become the dominant strain globally. Africa has reported many new Delta outbreaks in Tunisia, Mozambique, Uganda, Algeria and Malawi, among other countries. Dr. Jane Ruth-Acheng, the Minister of Health, says that the Delta variant initially identified in India, B.1.617, was first detected in the country in April 2021.
Analysis made for some of the samples collected from Kampala and Wakiso between the 3rd and 15th of June 2021 indicates that the predominant strain currently in Uganda is the Delta variant. That is the variant from India. The second wave, therefore, is driven by the presence of the Delta variant.
Scientists state that evidence from clinical settings indicate that the increase in transmission appears 2 to 3 months after the introduction of the variant into the community. Medics say that the country is now battling with more than 5 variants.
The so-called Alpha variant, we have the South African variant, which is labeled the Beta variant. We have, of course, a variant that is coming from India that has been labeled the Delta variant. We have a Ugandan variant, which we call the A123.1, and then we also have the Nigerian variant, which more recently has been labeled the Eta variant.
Viruses mutate all the time, and most changes are inconsequential, but others can make the disease more infectious or threatening. These mutations tend to be dominant. Those with potentially concerning changes are called variants of concern. These are kept under close watch, according to experts.
But there's a shift in the variants that we have to have now a dominance of more of these variants, what they call the variants of concern and the variants of interest, like those I've mentioned, in the current epidemic that we're seeing now compared to the start.
It's like the UK variant, the South African variant, and the Indian variant are associated with more ease of transmission between people, but also they are more associated with severe disease. So when you get affected with these variants, the chances of you getting more severe disease are higher. And that's why we see this time around more young people falling severely ill.
Uganda Virus Research Institute continues to do genomic sequencing as part of surveillance to curb the deadly virus.
Sequence the virus, and already the sequences, and what we mean by sequencing of the virus, you find out how it's genetically composed, genetic composition, and you compare it with other sequences all over the world, and there's a way you can say, okay, this belongs to this group, this belongs to that group. If it has this composition, it belongs to that group. If it has this genetic composition, it belongs to that group. That's how you look at it. So you have to do really a laboratory and go there, really look at the genetic makeup of this virus.
Variants behave differently, and truthfully, we have a long way to go to study these variants. A lot of work is taking place, including trying to infect cells with variants to study how much virus is produced every other hour or every other day. A lot of work is trying to take place in animals, but we are also studying people that are infected with these variants to understand how the variants behave.
The Alpha variant in the country of origin is United Kingdom, first identified in the country on 2nd February 2021. The Beta variant, the country of origin, is South Africa, first identified in the country on 2nd Feb 2021. The Delta variant, the country of origin, is India, first identified in the country on 15th April 2021. Variants of interest. The Eta variant, country of origin, is Nigeria, first identified in the country on 3rd Feb 2021. A.23.1, the country of origin, is Uganda, first identified in the country in June 2020. COVID-19 vaccines that are currently in development or have been approved are expected to provide protection against the new variants.
How protect against all variants. In fact, a recent study that was done to evaluate the efficacy of the AstraZeneca vaccine against the Delta variant showed that the AstraZeneca vaccine protects against the Delta variant to the same level as the Pfizer vaccine.
World Health Organization continues to urge states to follow current measures in place, like hand washing, wearing a mask, physical distancing that continues to work against new variants by reducing the amount of viral transmission and therefore reducing opportunities for the virus to mutate. Zahara Abigaba, New BC News.